Welcome, everybody. I'm so excited to be here today using my platform as National Lived Experience Practice Lead to showcase the voice of Simon Katterl. Before I go on, I'd like to acknowledge today that we are on the stolen lands of Aboriginal people. I'd also like to bring to your attention that a law has been passed in this past week giving the Commission for Indigenous Children independent powers, an important step in enshrining systems change to enact human rights in First Nations populations in Australia. When I saw Simon speak on human rights in community mental health, I actually felt a weight coming off my shoulders. It feels like a lot to carry the worries of the collective struggle in consumer survivor ex-patient movement. Simon so eloquently articulated the importance of a focus on rights and how we can support the actualization of rights across service delivery. So, as I said before, today will be recorded. So, feel free to turn your camera off if you would not like to be recorded. Please, everyone, be on mute during the discussion. If you have any questions during this session, please use our Q&A function. So you can access that by, if you can't see it on the bottom of your screen, if you click the more with the three dots, you should be able to see a section where you can add to Q&A. At the end of the presentation, we'll go through the questions. And I want to acknowledge today the lived and living experience of everyone here and the way that you bring it to work, even on your worst days. Thanks for coming to work today. Look, it's not easy, but you are making a difference. So, Simon Katterl is a nationally recognised lived experience and human rights leader. He's CEO of Mental Health Lived Experience Peak Queensland, and he's known for his work on rights-based reform, governance, and lived experience leadership. So I'll hand over to Simon now for his presentation.
Oh, well, thank you so much, Jemima. Thanks to the broader Neami team for putting this on together. It's not lost on me the privilege and opportunity to speak, and I hope what I talk about, and then hopefully what we discuss in the Q&A together brings some value to you, and to I know I'll get some value out of it, but value to your comrades as well who are joining us alongside you in the meeting today, or the session today. Just bear with me as I get my slides up and going. I should have, here we go. I just want to check that that's coming up for you all. Someone able, just Jemima, are you able to confirm that that's coming up for folks?
I can see it, yes.
Yeah, awesome. And please, I'll try my best to keep an eye on the chat as well. Please feel free to put any comments in there. I'll do my best to pick those up. But if I don't, please, we'll have time for a chat later in the second half. So, yeah, I've been invited and I'm privileged today to speak on human rights and community mental health. And before I jump into that, though, I want to acknowledge, and I'm privileged to acknowledge the country I'm on today. So I'm on the lands of the Yagara and Turrbal people, and want to pay my respects to elders past and present. If there are any First Nations members here today, I want to acknowledge you and affirm that sovereignty was never ceded, and that means real and personal responsibilities for each of us to support truth and justice. And there's work underway or work halted in different jurisdictions, and we all have a responsibility to support that. So, look, a little bit about me and about us. I won't spend too much time talking about me, but really, we are the Mental Health Lived Experience Peak Queensland. You could say our name about 5 different ways. You could say Malik, Malep Q. I've had about 3 or 4 other versions of it. We're in the process of changing our name soon, so at least everyone will say it the same way. But we are the lived experience peak body for people with lived experience of mental health issues in Queensland. If you're in other jurisdictions, you might want to put the name of your peak body in the chat. It might be you might be in Victoria, you might be in New South Wales, the ACT. I note that Northern Territory doesn't have a recognised peak as yet, but we are certainly supporting one to be established, and there's work underway there. But you might put in the chat, the peak in your area, so someone else, alongside you might learn about their lived experience peak body. And I can see some people noting in there Leland, the great work they're doing in South Australia. So I encourage you to check them out if you're in South Australia. So we're led by people with lived experience. We've all got lived experience. I've got my own lived experience of mental distress and trauma, and I've accessed public community and private mental health services. I haven't had lived experience of involuntary treatment, and so I don't speak from that particular lived experience. Our organisation, we do systemic advocacy where we advocate for the right for human rights and systems reform, and a system based on the expertise of people who use it. So a system that can't be about us without us, but also alternatives to that system. We always aim at reforming and transforming the system we engage with, but it's equally important that resources go outside of that system to what you can call alternatives, or just different ways of knowing and being. And so we always try to do both of those things, or advocate for both of those things at the same time. So as I said, we don't do individual advocacy or individual services. We instead influence policy practice and services, or at least we do our best to. And so we're babies. I think we're the youngest of all the peaks currently. So we're 4 years old. And I'll put some information at the end about how you can join us if you're in Queensland. We'd love to have you. We've got 650 members or so now, but we want to grow that so that we can ensure that we're representing your voice and expertise and elevating you to share that in the spaces that matter. But also, more numbers gives us more power and more authority to speak about the need for systems change as well. So I've been fortunate to be invited here to talk a bit about human rights. And so that's the purpose of today, is to talk a little bit as there's about 1,000 different places we can take the conversation, and I'm sure we'll take it to about 500 of those in the Q&A, which will be exciting. But I've got some kind of core questions that I'm hopefully going to unpack in this presentation, and we can explore a little bit later in the Q&A and discussion component. But the start is, well, what are they and why do they matter? That sounds like a simple question, but in reality, we could spend 4, 5, 6 hours unpacking each of these questions. So we're going to touch on that. But before we do that, I might actually ask if you're able to put in the chat, really, or have a think to yourself and then put it in the chat. But when it comes to mental health, what does just do this for the first component, but what does a good life look like to you? So what are some words or images that come up to you about a good life where well-being, where your well-being is best it can be, or even if you do have distress, what does a good life look like for you in that context of having distress or trauma? Maybe take some time to put that in the chat, and we'll see what's coming up for folks. What does a good life look like to you? And thinking really about internal locus of control. That's a great one. So, charting your own path. There's having freedom and autonomy. Absolutely. Being valued for me. Being able to make decisions about my own life. Work-life balance. Being able to live the same as everyone else. So accessibility. Connection, validation, recognition. Connections coming up again, choice, natural spaces, dignity and respect. I mean, these are vivid and beautiful values. Enough money, absolutely. And I guess the question is, enough money to do what? What are the things that we would do with that value? A self-determined, meaningful life I see in there. One of the people, when I first got my first lived experience job at Vimiac in Victoria, there's a man called Bill Moon, and he used to talk, and I still use this a lot. He used to talk about a good life as determined by me. So everyone has a right to a good life, but we need to each be the authors of what that looks like for ourselves, and the system needs to, to be designed in a way that is responsive to that. Being true to yourself and others, physical and mental energy, trust is a key component there I see coming up. And so I guess what if we contrast that on authenticity isn't a wonderful one there too, and authenticity is partly riding the highs and the lows of life as well. And I can see some important components in there about resources to make sure your general health is supported. Let's contrast it though. What does it look like? What does a bad life look like when it comes to mental health? What are some of the things that come up to you? And be conscious of not of what we put in the chat in case it might impact someone else. But what does a bad life look like? Life look like when it talks about mental health? We've got a lack of control and independence. Yeah, absolutely. So a lack of choice and control and independence. So being potentially stuck in institutional settings, being treated less than, no money, not being treated like a person. So actually not having your personhood recognized, being unheard. I hear you, masking it. Yeah, I think so not being, having to mask your distress because potentially, or mask your lived experience because it won't be recognized or understood. Gaslighting, not being understood, and hedonius, not having the ability to feel things. I think, unless someone can correct me if I've got that wrong, but the lack of affect or feeling, or ability to feel happiness, I might add. Discrimination, having your supports taken away. So we obviously want choice and control, but at times we want support too, and being discriminated. I hear you, and I hear a lot of these. And so I guess the reason feeling powerlessness is a key component, as is isolation. So I'm sure the chat will keep going, but I guess the point there is that human rights really, and we'll unpack this a little bit more together, but really human rights, it maps onto the things that we do care about. Human rights, when we talk about housing, we talk about income, we talk about choice and control, we talk about even things like trust. Human rights cuts through all of these topics. And it's a response to systems and services and attitudes that undermine what a good life looks like. So I think that one of the messages that I hope comes out of today is human rights don't necessarily define what a good life is, but they do reinforce your right to live one, and it does reinforce the system and government's responsibility to support each person's self-defined good life. And so human rights are, yeah, as we note, a check on just my camera. Human rights are a check on power. They're firstly a way to reinforce the value of a good life, but they sort of a check on state power, so the power of governments in majoritarian politics. So what does that mean? It means, well, we live in a democracy where the majority gets to decide what happens, but when a majority gets to decide what happens, it's often minorities that are most negatively impacted because their experiences aren't necessarily central to decision making. So human rights are a response to the inevitable limitations of democratic approaches where a majority gets to decide what happens. Human rights limit the use of power. They don't evade power, but they limit the use of arbitrary use of power. So power used in inappropriate ways. Human rights talk about lived experience participation and leadership in the Convention on the Rights of Persons with Disabilities. So human rights are about the nothing about us without us. It's literally embedded into the CRPD. Human rights are about putting the interests of the person most affected by a decision at the center of our concern if we're working inside of a system. So even if you're designing a policy or a contract for a new mental health service, a human rights framework says how will this particular contract or this part of a contract with Neami, with Wellways, with the hospital service, how will this contract impact on the person accessing services and most impacted by the decisions we're making today? So it literally forces us to bring that person into our mind's eye. But so I suppose that's another consideration, is that human rights are both a creature of the system, however we call it, and they challenge the system at the same time. And so there's tensions and contradictions in that, which are just a normal part of advocacy in life, but it's important to acknowledge. Then we can think about human rights and as I guess a bit of a thinking tool. And so here where human rights are, I guess, a way to imagine how we define a problem. So sometimes someone might see a problem as a question of risk, or as an unfortunate incident, or an adverse event. Whereas through human rights, you might say, well, that's an issue of equality, or that's an issue of cultural rights, or that's an issue of freedom from non-consensual treatment. Human rights invite us to imagine whose expertise matters. So it's often our workforce, or those of us with lived experience not in workforce roles, our expertise that comes last when we think about what a problem is and how to fix it. And then it also helps us revise better solutions to those problems because we've identified problems differently. So often the solutions that we have to the challenges in the system right now can make human rights worse. A human rights-based approach, it kind of thinks of it as it gives us, I guess, a thinking tool to look at the challenges we face in a different way. But I might, again, throw it open to the chat here. So why do you think human rights matter to mental health? So again, please put in the chat, and I'll be reading out. Why do you think human rights matter to mental health, or even to community mental health? So I'll start reading out those comments as they come in as well. What do you see human rights mattering to mental health? I see accountability there. I think accountability is crucial. Human rights are an accountability tool, so they're a way for us to make some of the things that we care about matter. Human rights, they matter because people accessing care have violations. So it moves it more from someone's opinion into, I guess, an accepted legal framework. Absolutely. I could see human rights are about fairness. I think that's a very good summary, I guess, of what human rights are about. They're about fairness, about equality. Many of the issues we talk about, we might call it stigma, but it might be discrimination, or it might be actually vilification. The Charter of Human Rights align with mental health care because it makes sense. So, a human rights-based approach often makes more sense. I can see someone talking about procedural justice. So actually, it's actually having a correct process to go through. Sometimes we can disagree, but human rights provide us a practical framework to step through challenges and problems. We've got access to the basics we cannot expect, and experience well-being and mental health. So human rights, another way to think about human rights is, what are the basic things that people need to live a dignified life? And that doesn't mean human rights are about everyone having a Porsche or a 7-story house, but what are the things for which everyone needs to be able to live a dignified life? Well, that in many respects should be a human right. We've heard about criminalization and infantilization, not being believed, so, epistemic injustice is connected to human rights and mental health. Support and equity, social justice. I can see a lot in here. So there's many connections between mental health and human rights. And I guess one of the other core components is, for why this matters, is the mental health system wasn't founded on human rights. That's really come 200 or 300 years late. We really only had the key human rights frameworks coming in the 1960s and onwards. And yet our system is one that here in what we're calling Australia, this was established on a custodial framework that fused together care and control. And so we uh, we have a system that was never built on human rights, was never built on some of these concepts that we're going to be talking about today and some of the concepts that you've put in the chat here today. So there's actually quite a lot of work to undo, a lot of the common sense, a lot of the things that maybe we don't even see are human rights issues because they are built so deeply into the system that we can't actually see them or others can't see them anymore. And so human rights give us a framework to unpick some of those elements piece by piece, but also do large scale transformation and reform. So bit on the slides probably violates every kind of rule I have about not having too much text on a slide, so I apologize. But I guess often we talk about human rights, but it's hard to know where to start, and there's so many different layers to it. So I hope if I don't sort of gobbledygook too much here, you can potentially revisit it as well if some of this doesn't stick. But it's important to start a conversation on human rights, talking about international human rights law. And so some of you might have heard of that before, but Australia, which is called a state, has ratified, you might say endorsed or signed up to a whole bunch of different international human rights frameworks. So some of them you might have heard of here: the Convention on the Rights of Persons with Disabilities, the Convention Against Torture, its optional protocol, which is called OPCAT, Convention on the Rights of the Child. There's a declaration that we signed up to, the UN Declaration on the Rights of Indigenous Peoples. Maybe people can put in the chat any other international human rights frameworks. And someone's made a very good point that we're good at signing up to them, but not necessarily enforcing them. And I think that's a very important reflection. And so what I guess that's the point of this slide, is to start a bit of a conversation on what international human rights law can do and what it can't do very well, and how we can use it. So it can put pressure on the Australian government and from the international community, via the international community, I might say, and the reporting mechanisms. So I think at the moment there are some international bodies that are coming out to review Australia's compliance with different international human rights laws. It can reflect Australia's commitment to international human rights law. So one of the differences between international human rights law and other kinds of law is governments opt into it. So you and I, unless we're sovereign citizens of any kind, we don't opt into the laws of Queensland or New South Wales or Australia. They just automatically apply to us. The international law, you sign up to it, so you actively sign up to that law to be bound to it. So in that sense, it reflects the express commitment of the Australian government. It imposes those duties then often onto state and territory governments. So sometimes Commonwealth governments can be quite excited or flippant in signing up to international human rights laws because they're not going to be the ones who have to fulfill the obligation. So when we think about mental health laws, those are usually state-based. So the CRPD, for example, calls for a radical change in the way we do, or even if indeed we have mental health laws. And so states sometimes are brought on a journey, meaning they don't pull their weight either. And then those human rights laws apply to everything, so not just mental health. They apply to child protection, criminal law, youth justice, climate. Some others might put some others in the chat about other laws that get impacted by human rights laws. Another might be land justice and land protection for Indigenous First Nations folks, relating to disturbance of native title, from mining companies, for example. So human rights law, what does it mean in mental health contexts? Well, it shifts us from that substitute decision-making approach where the system says a doctor usually can stand in the place of someone with lived experience and make a decision on their behalf, or and that often involves the use of force, seclusion, and restraint towards a supported decision-making approach. And some might have heard of that approach, but in effect, rather than taking away that right to make a decision, how the state, the government has a responsibility to support someone's innate legal right to express their views and preferences and make their own decisions. So some of you might have heard of know of the need to have wheelchair ramps, where once upon a time, we the community would say, well, you can't access that building because you don't have the physical capabilities to walk up those stairs. Whereas, over time, we all accepted that, well, that's discriminatory. That's an unequal form of accessibility, and everyone should be able to access that building on an equal basis. And now there's a requirement to have wheelchair ramps. In the same way that there might be difficulties in us accessing our decision-making abilities, rather than saying, well, you can't access those abilities because you have a mental health issue, the responsibility of the state or the government is to create a ramp, a decision-making ramp to help you or me or any of us get in a position to be able to make our own decisions, rather than say, we're going to do that for you. And someone's just put an important point in there. But even then, in some areas where the ramps were built, they didn't ask people with lived experience, and the ramps were on the wrong angle. And somebody might, thank you, Heidi. Somebody might put in the chat. There's a great meme of a swing underneath a tree about it being designed because they didn't ask people with lived experience about what they needed. I'm sure someone can find that and pop it in the chat. But I absolutely agree. So nothing about us without us. And so I suppose the point of that is to reflect that international human rights law can do a lot of things. It doesn't do so well at immediately driving change, but it does help us set where we want to go to and try to over time hold governments accountable. You can't use international human rights law on a day-to-day basis within Neami or Wellways to say this person's treatment should necessarily change. You can to say our organisation more generally needs to change and our government needs to change the way it engages with a service like ours and the laws and policies it passes. So it's not as useful in an individual scenario. And there's longer parts, longer explanations for that, but that's just a limitation. But more of this talk is a little bit more about the domestic human rights law. So domestic meaning within Australia. So we'll cover this in a little bit more probably over the next 15 minutes, and then I'll shush and hopefully hear from some of your expertise and questions as well. But I kind of touch on two things here today. One is you call them equal opportunity or anti-discrimination laws. And these apply and they're in every jurisdiction. So I've only put a couple up in Queensland, Victoria, and Tasmania. But would someone in New South Wales be able to find the name of their anti-discrimination laws, or in WA their anti-discrimination laws? See if you can put that in the chat. Or if your state's discrimination laws haven't been reflected there, see if you can find it for yourself. But what do discrimination laws do? They make it unlawful to directly or indirectly discriminate against someone in all parts of public life. So not so much at home within your home setting, but in any other part of public life. If you came into our organisation here at Malik, if you go to a shopping centre, if you go to a health service, if you go to a mental health service, if you go to child protection, wherever in the public, in your employment contexts, it's unlawful to directly discriminate or indirectly discriminate. And we'll unpack what those things can mean a little bit later, against someone based on a whole bunch of things. But in our context, mental health is the one that we'll talk about. So mental health is considered a disability. And so it's unlawful to discriminate against people. I can see Jemima's put in the Anti-Discrimination Act in New South Wales. And so that's, if you're in New South Wales, that's the legislation that you can make a complaint underneath there. Thank you, Lucy. South Australia's Equal Opportunity Act, absolutely. So Then there's also human rights laws, and so if you're, in the Sunshine State, or I can't remember what Victoria calls itself, probably the coffee state, but I'm a part-time Victorian myself. The windy city, absolutely, absolutely. The ACT. These three jurisdictions have human rights laws, which none of the others do just yet. I'm sure someone might be able to put in the good work being done by Being and other organisations to get a Human Rights Act up in New South Wales at the moment, though. So human rights laws, they do a couple of things that the other ones don't. So they put a duty on governments to pass laws that are as human rights compatible as possible. They also put a duty on a whole bunch of folks who make really important decisions that impact on human rights down the line. So they put duties on government departments making policy and funding decisions. So if you're funded by the Department of Health in your jurisdiction, in Queensland or Victoria or the ACT, they need to show that they considered human rights when they made the funding decision for you or for a hospital and health service. And our experience in Queensland with a kind of new Human Rights Act is there's still quite a lot of work to do, and we do a lot of that. Sometimes publicly, a lot of it behind the scenes. Um, Also, NEMI is in receipt of public mental health funding, and so to the extent it operates in these jurisdictions, it has to comply with human rights as well with that money. And similarly, courts have a responsibility to interpret laws as compatible with human rights as possible. So I won't dwell too much on that one, but I'm happy to talk about it in the chat. So um, human rights, I guess the reason we're talking about it here is there an opportunity to, I guess, imagine human rights as a bit of a lever for change. You can use it to support someone's individual care, but you can also use it to support organizational or systems change. And I kind of think of them as levers. They're not silver bullets, but levers for change. So here, anti-discrimination, or you can call them equal opportunity complaints. So this is if you want a practical example about how you can use human rights. Human rights can a complaint to an anti-discrimination or human rights commission can be used to make services more culturally safe or more disability accessible, more or less coercive. And those complaints can go to a human rights or equal opportunity commission. Now, again, that's an example. Someone might be able to put in, so Jemima, I can see Lucy, I can see Ryan and Dave there. You might Google, find out where do I make a complaint under the Anti-Discrimination Act or in South Australia, the Equal Opportunity Act. And that's the Human Rights Authority that you would make, or the anti-discrimination or equal opportunity. The problem is everyone's got a different name, so I apologize about that. But that's the place where you could make a complaint yourself, or the person you're supporting could make a complaint around discrimination. And those human rights commissions often, not always, but they have the opportunity to do systemic inquiries into human rights. So in Victoria, when I used to work at the Human Rights Commission in Victoria, they did a systemic investigation into mental health discrimination in the insurance industry, which I mean, probably the most I'd argue boring topic that they could have picked around mental health. But anyway, that's an important area. But we could say an investigation into discrimination in supported residential service settings, in community mental health settings, in hospital and health service settings, in uh, you might find various other settings. So they have powers to compel information and do a systems-wide inquiry into discrimination, and often we haven't encouraged them enough to do that based on mental health discrimination. So there's an opportunity there. I can see Jemima's put in the anti-discrimination New South Wales. That's absolutely right. Ryan, you've popped in South Australia's. That's absolutely right. So those are the places you can make a discrimination complaint. I'll give you a practical example though. So, you know, if we're thinking about cultural safety and discrimination, that's an example. So, but what would that look like in practice? What would discrimination look like in practice? Sometimes it's very obvious because someone might have a very clearly racist attitude about something, but often it's, oh, we treat everyone the same is often the response you'll get. So it's not discrimination. Well, often treating everyone the same is discrimination. And some, for example, if you treat everyone the same by not having a wheelchair ramp, then that's an example, I guess, of discrimination because you're excluding people, who have physical impairments around not around how they sort of their mobility. And someone's noted here, equality is not equity. Absolutely. So even equality under anti-discrimination law itself. Equality under anti-discrimination law actually requires people to take proactive steps so there is equal opportunity. So there's not equal opportunity to enter that building because there's not a ramp. So that's an example, even where equality requires a lot of work as well. So just to bring up this example, an intake process doesn't look at what someone's cultural needs. The model of care, maybe when it was designed, didn't account for people's cultural needs. Maybe it didn't include the importance of social and emotional well-being workers, First Nations peer workers, or traditional healers. So there was no sort of built the model of care didn't really account for that and maybe require staffing for those types of workers and that kind of expertise. So already by failing to do that, there might be an issue. Staff aren't trained in culturally responsive mental health care. So maybe when staff are onboarded, there isn't a formal process to ensure that staff are trained in culturally responsive mental health care. And similarly, because of all those things haven't been dealt with, maybe First Nation staff members don't identify as being safe as well. All of this could be bound up in a discrimination complaint, either from someone accessing a service or if you're the First Nations person working inside an organisation, it might be to say that that they can make a complaint themselves, and so that doesn't require any express hatred towards someone based on mental health or race, but it might be the absence of action is a form of discrimination. Um, and so I guess I highlight this, and there's much more I could touch on, but I'm actually going to speed up. Otherwise, I'm sure you'll all go into some kind of coma. But I'll speed up a bit. But where we conceptualize maybe law less as I'm encouraging folks to think of law less as a silver bullet and more as a leverage point. And the reason I say that is when you look at international human rights law, you might say, well, they never comply with it. Or, when we look at discrimination law, that won't change everything overnight, or human rights law, it won't change everything overnight. I'm the first to say I agree with you. Equally, if we make law the solution to everything, then we actually take away power from our own community to solve problems as well. So I'll probably put in the chat a really important discussion about how lawyers can take away power from community to solve problems. So if we see law as a problem, as a silver bullet, then everything's a legal problem. And then you just have lawyers talking in their legalese in ways that are quite detached from the actual problem or community that's present. If you see law as a silver bullet, all of the concentration of power sits in the courts and the legal system. If you see law as a silver bullet, then the venue where the contest or the contest takes place is a courtroom primarily. But if we see law as just a lever or a leverage point or a strategy for change, well, we see it as a mixture of a socio-legal problem. So of course the law is involved, but there's culture, attitudes, power, politics, a whole bunch of things that are bound up in it, and I think we'd all agree that that's actually the case for what keeps a lot of these problems in place. We then, if we see it as a leverage point, we see the the role and the power of community, of media, and of lived experience, rather than just seeing it's going to be the lawyers who are going to solve this problem for us. And if we see law and human rights as a leverage point rather than silver bullet, then human rights plays out in courts, but it also plays out in clinics. It plays out in Neami and Wellways. It plays out in the community. And so I'd argue there's a lot more value for us to see law in this second and human rights in this second vein, which means we've got lots of work to do. But it does mean we don't just hand over it all over to the courts. And I'd encourage you to look at the United States, where the Bill of Rights over there is much stronger. The Bill of Rights in the US is far stronger than any human rights framework we have here in Australia. And I'd argue human rights are not going quite as well over there as they are maybe here. So let's accept the responsibility to get the change in the places that we have control over. And so if we do that, we can use human rights laws to influence government policies, funding for services, workforce training. In Victoria, Queensland, and the ACT, you can get what's called like injunctive relief. I'm sure you want to get a lawyer to give you advice, and nothing I should say should be considered legal advice here. But you can get things like injunctive relief to stop, for example, a discriminatory policy or practice being done, to stop that until it's reformed or changed. And you can make complaints about breaches of the Human Rights Act in Victoria, the ACT, and Queensland to different bodies. In Victoria, you can go to the Victorian Ombudsman. In Queensland, you can go to the Queensland Human Rights Commission. And I think at the ACT, you can go to the ACT Human Rights Commission. They all have different kind of slightly different approaches. But that's another example. And I'm going to put in the chat later some free training to go in more depth about human rights laws as well. So, what does human rights mean to your organisation and the lived and living experience workforce? Look, I've got Neami here, and I'm very grateful for Neami making the space here. But there could be, if I had more time, I would put the Wellways and the mines and everyone up here. So we've all got work to do. But human rights in your organisation that you're working for. So human rights problems can come from how services are designed and delivered, the rules about who can access services. So maybe we don't accept people who have co-occurring needs, how crises and risks are handled. So sometimes the way that risk is conceptualized and identified and responded to can unnecessarily limit or breach human rights. Human rights applies to how information is shared and how you get consent for certain things in your organization. Human rights also applies to complaints. So, you should be able to pull open your complaints process at any of the NGOs you're looking at and see that the policy itself expressly says we properly consider and comply with human rights laws, because there's 3 jurisdictions where your organizations might work that have human rights laws. And if they don't, the reality is there's every chance that they could be found to be in breach of human rights laws in Victoria, the ACT, or Queensland. And so I suppose the lesson here is that human rights laws often happen because of the way things are set up by organizations, the culture and the processes. And those things are all often invisible, or rendered invisible because we've been doing it the same way for so long. But your clinical governance or your quality and safety meetings, your handover meetings, your induction processes, your workforce design processes, you got human rights obligations in all of those, your organization. And if they're not showing that they've considered them, they could be in a bit of trouble. And so that's useful because it probably reinforces what you've already said, which is we need to take more supported decision making, more recovery oriented, more culturally responsive approaches to what we're doing. All human rights does is say, yeah, that's a legal obligation, actually. And that it not only is a legal obligation, but the law actually requires you to often be able to evidence that you met that legal obligation at the time you made a decision. So I won't go into too much more depth. I can answer questions later. Um, We've spoken about this, but the lived experience workforce can translate human rights into more daily practice, link a lot of the things that we're already talking about to existing legal obligations, and kind of build coalitions within your organisations for change. If you have a look at the national guidelines, a lot of the things I think you'll see in the national guidelines, the values, the practices, and whatnot, they link very closely to human rights, and in those national guidelines, human rights are mentioned quite regularly. So what are some things you can do? That's more of an open question. I'm sure we'll actually hear from folks in the session today about that. But some things you might do learn more about human rights law. As I said, I'll put something in the chat in a moment about that, about discrimination and equal opportunity law. So they're different. I might add, if you're in New South Wales or WA, South Australia, maybe advocating to your governments there for human rights laws and jumping on board with the different movements that are underway to establish a Human Rights Act in your jurisdictions. Um, Provide information and resources to, participants, whatever you want to call it, people with lived experience who are accessing your services is crucial. And if your service doesn't have any information on rights in that way, maybe it should develop it. Support people to make complaints. Often I'm sure either you've directly experienced yourself or the people who you're engaging with might have experienced really inappropriate, coercive behaviour from a hospital or a health service or a public mental health service. And sometimes the best thing you can do is help someone make a complaint to the Human Rights Commission, or it might be to the health complaints body potentially as well in your jurisdiction. Raising it at daily meetings, I think, is crucial. So it's, if you don't get burnt out and you're not the only one doing it, see if you can get another comrade alongside you. Trying to get changes to those policies and procedures, seeking a review of your service. One of the things you can do is, and certainly at Malik, we're keen to do this work with organisations, is actually just help services do a bit of a review end to end of, well, are you complying with your duties, but also what would a human rights based approach look like if you reimagined what you're doing through a human rights lens. So there's a lot of work that gets done on lived experience workforce, but very little work that gets done around human rights, and a lot of investment that goes into lived experience workforce, but comparatively a lot less that goes into human rights. And yet the things that we talk about as a lived experience workforce are so often about human rights. So I think that's a potential gap for these organisations. And trying to develop, out of those reviews, develop an action plan in the same way that there's action plans around a whole bunch of other things that the NGOs often do. So what are some, I'll tell you a bit about our human rights survey and some of the work that we're doing, and then I'll shush in literally less than 4 minutes. So we've got a human rights survey that's underway at the moment. We have, it's finished. We've had 92 responses, in-scope responses. We're analysing the data at the moment. It's going to have really important analyses on human rights as it applies to housing, income support. I should add First Nations self-determination, equality, discrimination, a whole range of areas of First Nations cultural safety, accountability and oversight. We'll be making recommendations for change to the sector, and we're going to do it every year. So then we'll monitor to what extent government or services are implementing those recommendations, and we'll report that in the following year. And we'll also ask the same questions in the survey to see, how the system is tracking, I guess, on these key human rights issues. Our priorities, look, we do a lot of work in Queensland. Perhaps I'm doing that hive mind thing, but others might be able to pop in the chat who the local state peak is in their area, or the National Mental Health Consumer Alliance is the national consumer peak. But these are our Queensland priorities. We do a lot of work on, we're trying to get a Mental Health Act reform process up. We're trying to get accountability better built into our system. We have few levers to pull to get change, and we want to create some. As we've discussed, we want to get the Human Rights Act better implemented in Queensland. We've got one, which is good, but we've got to get it better implemented. both to make sure it's complied with, but also to help us reimagine some of those opportunities and issues we spoke about. We're big on lived experience leadership, so we've made some good gains here in Queensland, but still comparatively speaking, there's an enormous underinvestment in lived experience, and not just lived experience workforce, but people with lived experience in non-workforce representative opportunities. So consumer advisory groups and others who don't want to be part of the lived experience workforce, but do want to be part of change. And we're pretty big on psychosocial foundational supports being better funded and getting better outcomes for folks with lived experience. So if you want to join us, you can see our link. That's if you're in Queensland, if you are so lucky to be in Queensland. I apologise if you're not that lucky, but you will be able to find your other counterpart peak, and they're just as lovely and more charming than me. If you're in Queensland and you've got lived experience and you want to advocate for change, we would desperately love you to join us. So that's enough from me for now. I'll stop sharing screen, and I guess we'll open it up to Q&A.